Hi, today I am talking with a mom who's in our community. Her name is Nadia, and she has agreed to come on to share videos of her son Mohammed, who's 2.5 years old. And he is both hyperlexic and a Gestalt language processor. And we are talking about the use of my approach to get him talking, not just with pop out words, but get him talking a whole lot more throughout the day. So we are diving into my 5 big recommendations for Muhammad. And this show is full of some really good information that I hope will help you, whether you're a parent or professional, no matter how old your child or clients are. So let's get to this really great interview with Nadia. Okay, thank you so much, Nadia, for joining us today. And I know you're in Brisbane, Australia at this point, had relocated from Pakistan a few years ago. So thank you so much. I know you're on opposite time zones from me, so thanks so much for joining us.
Thank you so much for having me here today. And I'm just such a big pleasure here being with you and talking to you on the live chat. It's a dream come true actually for me.
Oh, that's nice. So, you posted in our online community, you're taking the toddler and preschooler course, and now you've added the verbal behavior bundle. So you posted a lot of success. And just to update our listeners, you have quite a backstory. Um, you were in Pakistan, you had your older son who's now 11. He was diagnosed on the spectrum, on the more mild end of the spectrum. You read my first book, The Verbal Behavior Approach, and as well as other books, and watched some of my videos, and you were able to really help your son on your own. And now he's doing well without any real support in school and progressing really well. So then you had another child, and then you just had Mohammed in early 2022, and he started showing signs of autism. So you read the Verbal Behavior Approach book again, started rewatching my videos, got him diagnosed at a very early age of 20 months in Australia, where you live now. But you have no services, you're on long wait lists. And so, in addition to reading my first book again, The Verbal Behavior Approach, you're reading the second book, Turn Autism Around. And most importantly, you joined the online course and community in early April. So, and one of the reasons I want to interview you is because your son has some words, but he's not talking
Yes.
in videos. He's only saying 0 to 5 words a day. These
Yeah.
are very much pop out words. And I know that you're going through the courses. I know my techniques work, but I wanted to do this hot seat, not just to benefit you, Nadia, but any of the listeners who might also have similar situations. So from
Mhm.
April
Yeah.
until we're recording this mid-June, has your son Mohammed made progress?
Oh, yes, a lot of progress. And I think he's just now in that moment when he is in a learning momentum, I call it. He's just ready for anything that I'm offering him. I remember when we started the program with the table time. It took me like about a week or two to pair him with the table, with the reinforcer. And he was just running back and forth, just wasn't ready. But with the right enforcers, so now he's just running to the table. The minute I put the table down, he's just coming on himself. I don't have to tell him that, Muhammad, come on, play time, or he just sees me that I'm just setting up the things. Just come and sit on himself. I mean, he's just ready to play.
And
Yeah.
you're really you're sharing your videos. We're going to put all the videos that you shared in the show notes here. And so then as I get, you know, kind of reflect on what I saw when I was watching the videos,
Mhm.
it's going to help a lot of people. And one of the things is
Yeah, definitely.
he is really sitting nicely at the table.
Mhm.
He seems to be enjoying his time, but I heard no words in the videos.
Yes, that's true.
Um, so he also, from early April until mid-June, which is 2.5 months time.
Mhm.
You also got rid of fecal smearing,
Yes.
a lot of mouthing, spitting, a lot of throwing things,
Yes.
throwing
Sorry. Yes.
food. So was that related to what you learned in the course?
Oh, yes, definitely. Because before April, I had no clue what to do, especially with the fecal smearing. I mean, it was just happening everywhere when I was just out and about. He was the minute I would just get late, he would just stick his hands inside his nappy and he would take it out and he would eat some of them and just smear everybody. It was just disgusting. Yeah. And I was just so worried. And this was the uh, first kind of a behavior that I encountered, and I had no clue what to do. So I read about your read in your book and also in your course about the prevention strategy, and it really struck me. And I just thought about it. I said, "This is gonna work." Like it just struck me that the concept of 95% of the behaviors we can prevent actually, because I was always believing that we can fix later, not preventing. I was just focusing more on the fixing side. So what I did is actually, so I had to keep an eye on it. And the minute he would just pass the fecal stool, and I would just quickly take him to the room and change it. I would
Yeah.
just not let him feel it. Yeah.
Hmm.
So I had been doing that for a whole month, and it just disappeared.
Hmm.
And now, even if I get late, he would not just touch. He would not just stick his hand inside. He just stands and wait for me. Yeah.
Yeah.
So yeah, the
Yeah, that's
prevention
key.
actually worked.
95% of your time on preventing
Yeah.
problems. And people always, that's the most common question. How do I stop my child from X?
Yes. Yes.
And it's like
Exactly.
it's you need to replace it. You need to
That's
prevent.
true.
You need to,
That's true.
and we're going to focus on mostly talking in this episode. What are the
Hmm.
strategies to get Muhammad and other kids like Muhammad talking? And you might
Hmm.
think, well, what does talking have to do with prevention of fecal smearing, prevention of
Yeah.
spitting and mouthing? And well, you can't spit and mouth um if you're talking. Like talking,
Yes.
once kids start to talk, you know, that stuff, mouthing is more for infants,
Yes.
But once
That's right.
we get talking, and also talking for, I have to go to the bathroom, I want my diaper changed, all of that stuff
Exactly.
is
Mm.
is really key. So we're not going to spend our time today talking about how you got rid of all the problem behaviors, but in the digital assessment, I do want to note, and we're going to include Mohammed's two digital assessments. His first digital assessment, which was very end of March,
Yes.
which was
Mm.
26% overall. Um, and then and you get ratings in self-care, language, and problem behaviors. So he went from a 26% to 2.5 months later, 42% overall. And
Yes.
all of his self-care skills improved, his language improved,
Yes.
and his problem behavior improved, all by
Yes.
about 20 points, which is great. So we still, though, have a 2.5-year-old child who has words, but we don't hear them much, and
Yeah.
has, he has a lot of catching up to do in all areas. He's still so what I did was I took the second digital assessment, which was done in mid-June. It's the Barbera Early Childhood Assessment. I did a
Mhm.
printout. You get the scores on the back. And then you take this assessment, which I've showed a bunch. It's still free. Tens of thousands of people have actually taken this assessment. You can get it for free at marybarbera.com/assessment. And um, you take this assessment and you go column by column and you make a plan. So I made a plan for him last night based on his exact assessment. And his strengths include he sleeps through the night, which is
Yeah.
excellent. And he has these pop out words and phrases, which we're really going to focus on today. He can count to 10. He knows his ABCs. Occasionally fills into songs or does little
Yeah.
scripts like "I see you," "Peekaboo," "I see you,"
Yeah.
"Ready, set, go." Um,
Go,
these
exactly.
are these are scripts or interverbal fill-ins. Um,
Mm-hmm.
he is has also improved with responding to his name, with matching, which he wasn't good at before, completing
Yeah.
puzzles, which he wasn't good at before. And he's also sitting at the learning table for 30 to 60 minutes at a time,
Yes.
which is excellent. Excuse me. So his needs are he's not regularly talking, manding, tacting, echoing. Interverbal subtest is pretty bare except for ready, set, go,
Yeah.
probably. He is also an extreme picky eater, which
Oh,
recent,
yes.
recently
Yes.
we did an episode on the 7 tips for picky eaters. We can link that in the show notes as well. Um, Grooming and dressing is still an area, still, not potty trained, but he's only 2.5, so um but I would start working on the prerequisite skills of pulling pants up and down, hand
Yeah.
washing, those
Yeah.
sorts of things.
Yeah.
And then also his receptive language is not strong yet, and following directions and that sort of thing. Um, so in general, I also watched the videos, like I said, which we're going to include in the show notes as well. And um, I wrote down 5 or 6 overall suggestions. So first thing, I would get professional help, as much as possible. Even though
Yeah.
you
Definitely.
helped your son, your
Mm-hmm.
older son, all on your own, and he did fine. We don't want to assume that with 30 minutes a day of table time and with reading books and watching a couple videos and
Yeah. That's right.
courses, and you're learning a lot. And I'm not saying that you can't single-handedly do it. Um, and you want to get the right professional help.
Yes. That's
So you
correct.
told
That's
me
correct.
before we hit record that you did finally get into a speech pathologist the other day, and she started talking about Gestalt language processing and how there's 6 phases, and we did a Gestalt language processing podcast a while back. We can link that in the show notes. And I am not an expert on Gestalt language processing, but my son Lucas, who is 28, um, he does have little scripts, which we talk about in that
Mhm.
episode. I've worked with thousands of kids directly, just like Muhammad. And he is probably hyperlexic too, which we've done
Yeah. That's right.
other episodes.
Exactly.
He knows his ABCs. He sings one,
Yeah.
you know, that and the gestalt of speaking in little chunks or phrases, that's all well and good, but it's not a different intervention that kids like
Mhm.
Muhammad need, in my opinion. My opinion is, yes, we want to encourage that. We want to look for signs. We want to, if he says, I see you loud and clear, we know that he can talk, he can formulate,
Yes.
I see
Exactly.
you. We can go into the scripts, the words, and say,
Yeah.
what of this is functional? What we can we generalize? What can we pull
That's
apart?
right.
What other songs could we sing
Mhm.
where we could get him to fill in the blanks? So in general, though, I think, and I've seen this, and I usually don't look at videos and I usually don't comment on anything like this. And this is for informational purposes only. I know, like, what, not even 1% of
Yeah.
Mohammed's life and programs. And so this is just in general. And I usually don't comment, but we have started some high touch coaching. So I have been taking a deeper dive. And I'll tell you that a big problem that I see is parents kind of wanting to just keep it to just themselves. And
Yeah.
and kids like Mohammed, when they're little, they need 20 or 30 hours of good, child-friendly ABA, speech, OT, whatever kind of services. It doesn't, even a good babysitter who's going to engage him with early learner programs
Yeah,
and
true.
play, it doesn't have to be a certain person or a certain type of therapy as long as everybody's on the same page and
Yeah,
doing the same thing. And I think I would just say, you're working hard to try to get professionals. I would continue to work hard, especially if your child has
yeah,
a diagnosis, and not count on the fact that, you know, reading books or listening to podcasts is enough. We have a online member now. Her name is Ruth, and she got on a call, a Q&A call one time, and she had a 5-year-old who was still not talking or not talking much. And she was so excited to tell me that she had listened to all the podcasts. At that point, it was like over 200 podcasts. And she had made some gains and things like that. And I calculated it later. It was like 165 hours of free content that she was taking in. So I don't want
yeah,
you to take in content, whether it's free or paid,
yeah, that's true.
and just be spinning and not being delivering, somebody being
I
paid
yes,
because
I
uh
totally agree with you, Dr. Mary. I totally agree with you. And also, because since with my first child, I was always available for him. I left my business, so I was there. But with my third one, it's not possible to be there because I have two other kids, and also I have a job.
yeah,
So I cannot give more than, like, I have seen that more than 3 hours or 2 hours. It's just so impossible for me. I get completely drained by the end of the day. So yes, I am seeking for help, and I have spoken to the different services, and I'm looking for the best, and found one too who is doing a verbal behavior approach.
oh,
Actually,
nice,
yes,
nice.
yes, this is just one. There is a one services, and you will be surprised to know that in Australia, AB has a really bad reputation. It's
Yeah,
a really, yeah, it's all over the world. I think for some reason I don't get it. Yeah. So usually services here, they don't tell people if they're doing an ABA. So they name it in a different way, in a different it's a child led, it's a child yeah, friendly. They name it in a different way. Yeah. So we have to figure it out how they work. And after talking to some services, and I figured out that there's just one, and I'm going to contact them. And I have contacted them already. So I'm just waiting for the funding to be here, and the minute I get it, Muhammad will be there the next day. So
yeah.
yeah, this is my plan for now. Yeah.
And you are going to have to remain as a big part of his program and his plan
Yeah.
as the captain of the ship, which I talk about in my second book.
Yeah.
Okay, so some other recommendations. I do recommend in my course and in my book that you take a language sample at the beginning and at the end after 2 months. But for kids like Muhammad, I would actually do language samples um, every day, every week,
Yeah.
a lot more. And I also recommend in my courses um, doing number one word list and number two word list. So number one word list is clearly articulated words or phrases.
All right.
Word list is
Mhm.
missing some sounds and that sort of thing. Um,
Sure.
you have put these pop-out words in a big long list on a skill tracking sheet. I would not put them on a skills tracking sheet. We're going to link that in the show notes. I would instead put them on an Excel sheet so that you can alphabetize them. And then
Right.
that way you can have an alphabetized list of words
Mm.
you heard. Um, and then the unclear words in the number two word list, you can start to work on to move over to the number one word list. But getting that alphabetized list, so if I know he says monkey and now he just said milk, I know that I can add milk to the list and then alphabetize
Right.
it. So then I know what is on the list and I can keep this list going and updated. Then we want
Right.
to use that list to make sure that the materials are as good as they can be.
Mm.
I would, because he likes letters and numbers, I would add letter puzzles,
Yes,
number
I have. Yeah.
matching letters. Um, I usually say don't focus on letters and numbers. And I don't want you to hyper focus. Like, I don't want you showing him monkey with an M or the
Mm.
word. I
Yes, yes, I do.
to focus on he likes letters A, A. I want you, once the letters are built, to do some sing-songy games, fill-ins. A couple of weeks ago, we published a podcast, a video podcast on the techniques that I use in my Miss Mary videos that I made decades ago, and
Hmm.
Miss Rachel uses on her popular YouTube channel. But getting him to A, B, C, D, getting
Yeah,
those
exactly.
kind of things going. We are going to use letters and numbers to go in the back door to try to get him echoing, to try to get him saying the words, everything on that number one word list. We should work hard. Okay, you can say
Yeah.
monkey. We've heard monkey a week ago. We're going to make sure we have two pictures of matching monkeys. Um, for matching, we're going to use those in shoebox. We're going to have a monkey uh thing, whatever, 3D objects. So if
Right.
it says sheep or ba, we can get a shoebox. We can cut a big slit in a shoebox. We can get
Right.
sheep, like a little 3D
Mm.
um, we can
About,
use
yeah.
fake food, little utensils, shape sorter shapes in our 3D shoebox. So I do think that we have to do better at getting updated language samples, updated number one word lists, and getting materials that reflect, like, if I paid you $1,000 for Mohammed to have 10 words today or 100 words today, what would you have to do? Getting back to the Miss Rachel, Miss Mary videos, we had a child, Kurt, who I talk about in my Turn Autism Around book, that we literally came upon this video modeling as the
Hmm.
key to expand his language.
Oh,
So,
wow.
and I saw on one of the videos, he does like to watch videos and use apps and that sort of thing.
Oh,
So
yes.
that
Yeah.
Miss Rachel episode in the show notes as well. Um,
Sure, sure.
so we were going to continue to add the materials to the early learner programs. I
Mhm.
saw in one of your skill tracking sheets that you were trying to like master a puzzle. The puzzles aren't mastered. Shoebox isn't mastered. Potato head's not mastered. We are going to use anything to get language. Um,
Yes, that's right.
and then once we get, once we pair the word or sound A, now we've got the puzzle built. We're going to keep these puzzle pieces though in a baggie. So now I can practice receptive. Give me S,
Mm.
S,
Right.
put in the bag, S.
Mm.
So we're, potato head. Oh, give me the
Mhm.
nose. And just a really picky thing in the video, which we're going to link in the show notes, the potato head, he's putting the nose in, you're holding the potato head, have him prompt him to use his second hand to start.
Overhand. All right.
If he's
Yeah.
using two hands to do things, I think that would be
Sure.
good. Um, Number four, focus on feeding. Uh,
Mm.
Feeding and talking are very much linked. Is he still using a bottle?
Bottle in sense, yes. He because since he's so picky eater, so he just eats a very I mean just few things only. Morning he's eating French toast. That's the only thing. He left pancakes. He left. some other foods. So in lunch he eats chicken kebab. So I put some um, spinach and potatoes and all the mixed things that he cannot see. But other than that, he does not eat anything else. So and sometimes he even reject those. So when he reject those, so I have to offer him a milk. So from 6 bottles we started a day. And then now I have reduced it to 3 bottles. So one in the morning, one in the afternoon, and one in the night. And that's it. So I don't give him the fourth one by
Can he drink what
anyone.
is in the bottle out of a straw or open cup?
Yes. Not from open cup. I've tried. He has no clue. He just tries to do it with his tongue. So
Okay.
he drinks water with a straw. So he has a cup in the straw and he drinks with that. Yeah.
Okay. So in my book, Turn Autism Around, in chapter 10, there's a feeding chapter and there's the easy, medium, difficult food list. You're going to
Yes,
want
I
to,
made that.
there's 6 tips or six or seven tips for weaning. I would really work on transitioning him away from a bottle to a straw cup. And you can start putting smoothie things in and
Um,
getting and he also of course seek professional help if he's malnourished, if he needs vitamins, if he needs blood work, like what if you would have.
Yes, we just recently did. Yeah, we recently did, and he was really deficient in iron. It was 6,
Okay.
just because of his iron intake. So we are on supplement. We're using that, and also we're gonna get a test for his pica, that too. But it just vanished. So I still will get the test done after two
So is he
months.
doing, is he having pica still?
Not really, not really, but like sometimes, very rare. Sometimes happens, like if he sees something new, so he would just put in his
Okay.
mouth for a little few seconds and that's it. Because before
Will
that,
he
it was
swallow things
happening with
still?
everything.
Will he swallow things still? Like, will
He
he
would not
ingest?
swallow.
Okay.
No.
So there is a difference between mouthing and ingesting. So
Mm,
ingesting is pica. I've done video blogs on both pica and mouthing and chewing. We can link those in the show notes. Um, but yeah, he could also have problems with zinc. That tends to lead to
yeah.
in um, copper, zinc to copper ratio. I've done
Yes.
other on this, but yeah, in general, I would really encourage you to look at making a big part of the plan to wean from the bottles, not to, but to transfer it over so he's taking in good
Yeah. That's good.
through a cup and a straw. And
Yeah.
then if you get, a cup that you can't see through and he's willing to take that, then you can put smoothie stuff. You could put his iron supplement. You could put spinach and things like that. If he was able to, eventually. You can't do anything
Yeah.
abruptly with a huge picky.
Exactly.
But it
Yeah.
sounds like
Exactly.
it is getting better. His eating, his mouthing, his pica is all.
Yes, yes. I would not say the eating. The eating is still the same. I've tried giving him some different food, as you suggested in your videos, one of your videos, that some reinforcer, high reinforcer, and before they, but he would just start whining. He would just leave the food. Or even he loves his screen time, so I would just stop the screen time and just wait for him and ask him to take it. He would not. He would just leave everything. So with food, I'm still struggling. I'm very struggling, and with vending, but the rest of things are just improving. All his challenging behavior has disappeared. So he's a very happy baby. Uh, he he is he is actually understanding when I tell him, uh, "Here's your water." So he comes approach me. I said, "Come and have your cookie," and he comes and approach me.
Mhm.
So he's not throwing food. He's not throwing toys. It's just that it's just ongoing. I'm working on the right now on the self-help skills and the food. Keep offering him, but he's just not taking it. He's just putting them back on the plate. Yeah.
Okay. So there's feeding in module 4 of the toddler preschooler course, and then there's a feeding bonus video in the verbal behavior bundle that you can watch. And then for everybody listening that's not a part of the course, you can always search Mary Barbera feeding. I've done a lot of work on feeding, and there's a lot of good tips. And for kids that
Right.
have serious feeding issues, picky eating, of course, swallowing, chewing issues, you want to consult with a professional. And
Yeah,
at the
yeah, I think you're right. Yes,
yeah,
because I remember with my first child, I did the same approach, and he started eating, and I every week I was just introducing to new food, and he was accepting that with a reinforcer. But with Muhammad, he's just not accepting it. He completely rejects it. Yeah, he stays hungry. He just stays hungry, and he would not taste a single thing. He would just spit it out or take it out. That's it. So yeah, I'm just clueless. I will definitely watch again those videos.
yeah,
You know, come.
and reread that chapter on feeding too, because sometimes hearing it or reading it,
Yeah,
sometimes, and then finally to really focus on manding and reinforcement, like you were just saying, like if you say, "Come get water," when you were doing table time in some of the videos, you would just in between things, you would just put a little piece of chocolate on the table.
yeah.
Where I would make a huge deal, all of our early learner materials have manding in them. If they want the sheep to put in the box, that's part mand. So, but when you're delivering reinforcement at the table or away from the table, make sure you make a big deal. If you
All right.
offer choices, do you want chocolate or do you want
Mhm.
berry? Or
Right.
chocolate or you want chips? And you can have them in clear baggies so he can
Mhm.
just reach for the chocolate. Oh, you want chocolate, chocolate,
All right.
chocolate. Because I felt like the reinforcement throughout was just a little weak. Want to make a
Okay.
big deal. And we
Right.
also want to incorporate songs, song fill-ins, song time to take advantage of any of those intraverbal fill-ins,
Yeah,
song.
yeah. That's correct. Yeah, we do that. We do that. Like after table time, we usually do it. Me with my other children's
Yep.
all the time. We're singing song. We're filling up the song. We do that all the time. Yeah.
And that's great to include your other kids, or if you don't have any other kids, for the listeners, you can include like an adult pretending to be a kid. Remember when you're doing song times, and this is covered in that episode on Miss Mary and Miss Rachel videos, make sure you sing slow in an animated tone, head, shoulders, knees, and toes,
Oh,
and
yeah.
encourage your kids to also sing slowly, um, and encourage Muhammad to fill it in. So
Right.
before we end, what are your hopes for Muhammad?
Well, hopes are high, obviously, and yeah. So I am hoping that by next year he would be able to mend a lot of things. Since I can see that things have been changing rapidly every week. He seems to be a different person now. He's doing different things now. I mean, I can see, and it just warms up my heart to see him progressing every week now. So yeah, the men thing, I'm hoping by the time, and I might be able to get the we'll be able to get him into the one of the services, and then this will be like he will get a more drill there, and with my help and with the services, obviously he will be able to mend, and this is my biggest dream to see him talking. Yeah. So yeah, this is all for now. Yeah. Let's see.
Well, I hope that these recommendations can help
Yes.
and can not only help you, but help our listeners. I think you took a huge step by joining our courses and
Yeah.
and continuing on with the membership because there's so much to learn, right?
Yes,
And
definitely.
And we just want each child to reach his or her fullest potential, whatever that is. And so I think with a captain of the ship like you, Nadia, Muhammad's going to do great. So thank you so much for sharing
you
your
so
video,
much.
for your time, and um, and I wish you all the best.
Thank you so much for having me and giving me the opportunity to talk with you today live on Plan Muhammad's goals. Yeah, thank you so much once again.